Uh, Good morning. Uh, Thank you for the opportunity. My name is Antonius Christy Jokatmojo, come from Internal Medicine Department RSUD Dr. Muardi, Universitas 11 Maret Surakarta, Indonesia. I'd like to present my presentations about a 39-year-old woman with cerebral space occupying process or SOP, possible neurocysticercosis with differential diagnosa tuberculoma, moderate SLE, and ulcerative pancolitis. First of all, the introduction. Neurocysticercosis is a central nervous system, or CNS, infections disease caused by the larval form of the tapeworm parasite from Taenia solium. It is the leading cause of neurological disease in developing countries and causes a toxic inflammatory reactions. Tuberculous meningitis is associated with significant complications of CNS accompanied with by non-specific clinical features. The SLA is a complex autoimmune disease associated with multiple autoantibodies and use 2019 Euler ACR criteria is essential. Vasculitis inflammations of the cerebral blood vessels cause lumen obstructions, the increase of coagulations, and loss of function of neurological aspects. Here are the case illustrations that I take from the 39, 39 years old women. We present a 39-year-old woman with a headache that has increased over the previous 2 months and a fever that has not been reduced with antipyretics. The SLA criteria were used to find mouth ulcers and kidney issues. The chronic proteinuria is more than 3 plus. The laboratory shows dyslipidemia, hyperosmolar normovolemic hyponatremia, and mild hypocalcemia. The calcium ion 1.14 millimole per liter. The CT scan show a suspected small abscess mass in the right parietal lobe with perifocal edema and cerebral infarctions in the left external capsule. A colonoscopy revealed ulcerative pancolitis with ulcerative colitis suspected, and she received 1,500 kilocalorie high calories with high protein diet therapy and citicoline 250 milligram per 12 twice a day, the paracetamol 1 gram twice a day, the ceftriaxone 2 grams once daily, the metronidazole 500 milligrams per 6 hours, dexamethasone 5 grams per 8 hours, and sulfasalazine 250 milligrams twice a day, and folic acid once daily with the dose is 800 microgram. The vitamin D 1000 IU per 12 hours, and the atorvastatin once a day with a dose 40 milligrams. She had comorbidities with the possible central nervous system infections, and to determine the source of the illness, the more testing is required, including the invasive testing such as a brain biopsy. And in autoimmune individuals, the presence of these infections can lead to more severe symptoms. Here are the support examinations. There are three images, and the first one is show that the CT scan of brain. Here are in my presentation here. There are CT scan of brain mass, the suspect mass with small abscess in the right parietal lobe with perifocal edema and cerebral infarctions in left external capsule. And the second figure is ulcerative pancolitis, suspect ulcerative colitis. And the supporting examination, the third images came from the MRI brain contrast. There are restrictions lesions leading to a nodular granular stage neurocysticercosis DD tuberculoma. In here, with the at the gray matter with the white color here over here. The discussion: neurocysticercosis can be diagnosed by CT and MRI brain. The treatment of NCC includes cysticidal drugs. We can use the albendazole or praziquantel, and neurosurgical procedure depending on the situations. The further examination is needed to establish the causes of infections, for example, with brain biopsy. The presence of these infections can be can cause more severe manifestations, especially in autoimmune patients. And the last but not least is the references. I take 5 references to complete my poster here. For the datas, there are 5 datas with the references to complete this poster. Thank you for the opportunity. Uh, Good morning.